Hey, what's up guys? It's Dr. Bayan. I'm a recent medical school graduate and I started this channel, Mental Health Nation, to help reach, engage, and help as many people with their health as possible from the comfort of your own home. Now, if you're watching this video in particular, it likely means you or someone you know has been experiencing migraine headaches. And migraines are actually one of the most common health conditions, okay? An estimated 13% of people worldwide suffer from them, and it's actually more prevalent or more common than things like diabetes and asthma combined. So you or someone you know is definitely not alone. And I personally do get asked all the time what someone can do for their migraines. You know, they've been experiencing, they've been going through the normal treatment protocols, but still get them, you know, more often than they want to, or the pain is more severe than they would like. So they just want some assistance in that. So instead of explaining the answer to every person or every time, I decided to make this video and be able to reach, you know, whoever wants to listen to it at any time. So much of this information I learned from more experienced physicians in the past, and I've seen it work on folks, you know, and people and patients time and time again. So there's actually growing evidence that migraine headaches and other kinds of headaches, like tension headaches, may actually be linked and have some overlapping features. So some, if not a lot, of the advice given in this video should be transferable to other forms of headaches as well. So before we start, what is a migraine? So a migraine is obviously a headache, and it usually occurs on one side of the head. It can come after visual aura. Visual aura is just a fancy name for flashing lights. You know, it can often resemble a neon sign, is what I've been told. There can be confusion associated with the headache, disorientation, nausea and vomiting, diarrhea, sensitivity to any kind of light or sound, ringing in the ears, paleness in the face or skin, dizziness, tenderness on the scalp, and a pulsing pain. Okay, so there's a variety of symptoms. Of course, you don't have to have them all to be considered or diagnosed with a migraine headache. And there's many different kinds of migraine headaches, including one that doesn't even have a headache, but only has the visual aura component of it. But for the sake of simplicity of this video, I'm going to avoid, you know, diving into any of them or anything really super scientific at all. Before we get into some of the treatments or things that can help you with a migraine headache currently or in the future, I do want to get into some of the red flags of headaches, okay? So because headaches are not always benign, right? They can actually signify pretty serious disorders or things. So in the event that a headache were to come after or before any kind of neurological symptoms, like weakness or numbness in one of your arms or legs, that's a red flag. Another red flag would be a loss of speech or any kind of loss of consciousness. In those cases, definitely seek emergency care immediately. So now that we know what a migraine is, I'll get into what's traditionally recommended by your primary care provider or your doctor. So these are likely options that you've seen or been informed about in the past. They do remain effective, and I'll, you know, dive much more depth into additional supplemental, alternative, natural, and medicinal ways you can treat these migraines afterwards. So you may have heard from your doctor, you may have not have heard. So some common practical traditional ways you can help prevent your migraine headaches and deal with them when they come on is, of course, to stay hydrated, resting in a quiet room that's ideally low in light, alternating hot and cold compresses on your forehead or behind your neck, massaging your ears, and even the top of your head, the crown of your head. And of course, you may have been prescribed pain relievers, and you may have been given, you know, medications like. It is important to avoid any kind of triggers. So hopefully your physician has consulted you about this. There's many triggers for migraines. It really varies on the person. But some of the big ones that sometimes go unnoticed is MSG, or monosodium glutamate. And this has many different names that I can't really dive into this video about just because it's so complex. I'll make another video on MSG in the future. But it's important to know that it can come in many different forms and names. So it hides on the ingredients list, unfortunately, very well. So besides that, things to avoid will depend on the person, but this can include chocolate, caffeine, you know, cheese. And another big one is artificial sweeteners, particularly aspartame, okay? Because these can affect really the whole body, but especially the brain and, you know, potentially the blood vessels in ways that can help precipitate migraine headaches. So avoid those. So while all those are effective, it's sometimes just not enough for the average person to help alleviate all of their stress or pain from these migraine headaches. So I'm going to give you many supplemental options that can dramatically decrease the onset, the duration, and the severity of your migraine headaches, okay? I'm going to make this list super comprehensive. So experiment with them. They're all safe. They're natural supplements. They're all easily purchasable and cheap. In fact, I'll leave links in the description of this video if you want to take a look at any of them. So, research has linked migraines to deficiencies in a few things in the body. You know, things that are naturally supposed to be in good concentrations in the body. And these are magnesium, riboflavin, which is a B vitamin, CoQ10, and vitamin D. Okay, so we'll jump into all of these. So first is magnesium. And magnesium is probably the biggest tip or the biggest thing I can tell you about decreasing your migraine headaches, okay? So magnesium does many things in the body. It naturally reduces inflammation inside the blood vessels in particular. And obviously blood vessels can reach your brain. It can feed the scalp. So it's important to optimize your levels in your blood vessels. It can also help relax some muscles, okay? Relax muscles anywhere in the body. In this case with headaches, because they're going to be associated neck pain, it can also help calm the neck pain as well. So an important thing about magnesium, okay? It comes in many forms. And I wish there was no nuances to any of this, but unfortunately there is. So most people typically, when they hear about, you know, magnesium, they go to the health food store and they want to get, you know, some magnesium, they'll go for the cheapest form, and that's usually magnesium oxide. And unfortunately, magnesium oxide doesn't have very good absorption from the gut to the body, and it also doesn't have very good, if any, ability to cross the blood-brain barrier. So the types of magnesium that you want to actually get is magnesium citrate or magnesium malate. Okay, ideally in a slow release form so you can keep getting these bouts of magnesium throughout the day. And I'll leave a link again in the description for a perfect supplement that I found. It's also important to note, high sugar diets deplete magnesium in the blood. Okay, so magnesium is kind of like a protective mineral against anything, especially things with the brain and the heart. So you want to optimize your magnesium levels as much as possible, and high sugar levels can deplete your magnesium. So avoid high glycemic carbohydrates and sugars. Number 2 is riboflavin. Okay, riboflavin is vitamin B2. And particular, a form of riboflavin has been shown to be very effective. It's called R5P, or riboflavin 5-phosphate. And this is the form of riboflavin, at least one of the natural forms of riboflavin that occurs naturally in the body. So that's another supplement you can easily purchase and use on a daily basis. Number 3 is CoQ10. Okay, if you've heard of CoQ10, it's getting pretty popular now. CoQ10 is something that's used to make energy in your cells, and you can easily find supplements for CoQ10 at any store. 4th is vitamin D. Make sure to optimize your vitamin D levels. I recommend your levels to be between 40 to 50. You can easily get those checked by a blood level. So stock up on those supplements if you're having migraines. It's going to make your life better, but there's also many other additional supplements that I'm going to get into that can help you even more, right? So there's different layers to this. I've given you the traditional layer, I've given you the main deficiency layer, and now I'm going to give you some more extra supplements to put the cherry on the top, okay? And the first one of those is going to be lipoic acid, okay, or lipoic acid. And many studies have shown a reduction and frequency of migraine headaches with its use, okay? One note of our lipoic acid is it lowers blood sugar levels. So if you have any kind of problems with drops in blood sugar, do not use it. Another one is hesperidin, and this is a natural antioxidant that is high in oranges. And you can, of course, eat lots of oranges. The problem with oranges is high in sugar, and that can deplete your magnesium levels. So I would recommend just getting an easy-to-use supplement for hesperidin. And what this does is it reduces pain by calming your nerves. And magnesium works the same way. So you may be asking, okay, those are great, but what can I do right now? Because I'm in pain right now, and these supplements are going to take some time to kind of get going, or at least take time for me to purchase them and use them. So here's some bonuses that you can use if you're in pain right now. You can use immediately. But before I jump into those, make sure to subscribe to my YouTube channel. Okay, it's called Mental Health Nation, so you can be up to date with any kinds of updates as soon as I put them out. So for your migraines, the first one is going to be try to smell green apples. Okay, so the scent of green apples has actually been shown in a study to relieve migraine pain. Another one is to mix some cayenne pepper, 1 to 3 teaspoons of cayenne pepper in a glass of water, drink it, and it's been thought that once it hits your stomach, it triggers a release of endorphins in your brain, which decrease your pain levels, and that can potentially work. Really anything spicy can work, so things like wasabi or paprika or buffalo wild sauce, it doesn't matter. And another quick tip is to use powdered ginger. So mix about a 1/4 teaspoon of powdered ginger in some water, drink it up, and within minutes, if not a half hour, the migraine should decrease in severity, if not diminish completely. And last but not least, if you've tried everything and nothing has worked for you, there is one last option that I'll recommend. It's called hyperbaric oxygen therapy. Okay, so this is an expensive modality, but as a last resort, I figured I'd throw it in. And of course, before I let you go, don't forget that most obvious signs, such as getting good sleep and lowering your stress levels in however way you find most effective. Okay, that's all from me, folks. Thank you very much for staying tuned all the way till the end. If you did stay tuned, if you're still watching, I can tell you're very serious about your health, very serious about learning anything about health. So I want to commend you for that. And I think that's a great sign for your future. All right. So again, thank you for watching. Make sure to subscribe, and I'll catch you guys next time. Peace.